Well, Sitaram, and a pleasant good morning to all of our viewers and listeners, and welcome to another edition of the program Addiction and Recovery. It's another wonderful Thursday morning here in Trinidad and Tobago. So, without further ado, let me introduce the host of the program, Addiction and Recovery, Mr. Ramnaresh Dwarka. Sitaram, sir.
I'm Jason, and thank you for having me on the program. And let me join with you in welcoming all our listeners, both here in Trinidad and Tobago and worldwide, who follow the program. And I know a lot of people have been following it on YouTube as well. It is posted at the end of the program, it is posted on YouTube. And so, those of you who are unable to follow the program during live, the program is also repeated at 10 p.m. every night on the same radio station and TV station. And of course, you can type in my name, Ramnaresh Dwarka, and you will be able to access all the programs that have been posted so far during the past year and the current program. And you can view it at will and even refer it. Some people are referring it to friends and loved ones who they think might benefit from the program. So it is becoming a resource that one can use to help themselves. We have been talking about making resolutions in the past. We have been talking how to sustain those resolutions. This morning, I would like to speak a little bit about how do you choose a program. You know, not every program is good for each individual has different needs. So it is important to select a program that matches the needs of the person in particular. There are some people who will not want to go to a public institution for treatment, a hospital like the Substance Abuse Prevention Center. Sorry. And maybe because of their lifestyle and their work or their domestic arrangement, are unable to leave to go, especially women, for instance, who have a family to look after and so on. They are unable to leave their family unattended to go into an in-house program. So some of these will have to be treated as an outpatient or may have to seek other methods. Then there are those people who, because of the stigma associated with drug addiction, they will not want to go to a public institution. So it is important that we find ways and means. Sorry, this morning I have a little bit of a cough. Please excuse me for that. So selecting the right program, the right fix, and planning the right treatment approach is critical if we are going to have success with the particular person. So that how do you decide? Well, it's even more difficult because this is a disease of denial. So that the person themselves start out from being very reluctant to even seek help or to admit they have a problem. So there are all these hurdles. First, you have to get the person to agree. Because yes, I know that there are family members and employers and so on and spouses who have threatened the alcoholic or the drug addict to go and seek help. Sometimes they are charged by the police, they are breathalyzed and they have to attend court, and as a result, they are advised by their lawyers to go seek help as a way of offering an explanation in mitigation so that they may be able to be treated in a much more less difficult manner, or they may not have their license suspended and so on. So yes, for those people who go to a program begrudgingly, who are sent, they feel that they are under duress, it is very important that they go to a program that can deal with that level of denial. And usually in Trinidad and Tobago, I know we have what is called, we have inpatient program at Cowra Hospital. the Substance Abuse Prevention and Treatment Center. Then there are also in-house programs offered by non-governmental organizations like the New Life Ministries at Mount St. Benedict and at Santa Flora. There is also the Rebirth House that offers in-house program, and their offices are on Charlotte Street in Port of Spain. They have a center at Chaguaramas and one in Port of Spain as well. Then there's the Serenity Place at Cochrane Village in Point Fortin, and that is specifically for women, as is the Santa Flora institution hosted by the New Life Ministries. These are two centers that are specifically for women alcoholics and drug addicts. And there's also the Heal House, which was originally sponsored by the sugar company, Carnegie Limited, but it is now an independent voluntary organization. And it is located at near Presal Village in Couva. So in-house treatment are best, and of course at Substance Abuse Prevention Treatment Center in Cowra Hospital, that is an in-house program as well. So in choosing any program, one would want to consider whether the person is motivated for treatment or if they are still in denial, if they don't think they have a problem. You also have to consider whether the person can access the program, because a lot of the in-house programs, they are sometimes fully booked and they have a waiting list of people because of a scarcity of resources in Trinidad and Tobago. And then there are some that charge a fee, and of course, a lot of people, alcoholics and drug addicts, would have, by the time they realize that they need treatment, would have exhausted all their financial resources and sometimes are unable to pay to go into a program. I know that in other parts of the world, like in the US and so on, people do have health insurance that would pay for the program, and so you can access an in-house program based on your ability to pay. The paid program, and I must say about the Substance Abuse Prevention and Treatment program at Cowra, because I worked there for quite a while. It is usually staffed by professionals. At Cowra, for instance, you have doctors, you have social workers, we had a psychologist at one time, there are mental health officers, there are psychiatrically trained nurses. And so it's an ideal program. And because when a person goes in there, they have a complete evaluation. And this is very, very important as well, to have an initial evaluation. For instance, the patient will have to be screened to see if they have any communicable diseases, like tuberculosis is very infectious. And because of the lifestyle of alcoholics and drug addicts, they are exposed to a lot of health problems, HIV, tuberculosis, because they don't take care of themselves. They don't have a proper diet. They don't observe proper personal hygiene. They don't go get their medical checkups, so that they could be carrying a lot of other communicable diseases with them. And no treatment facility will want a person coming in and infecting their population that they already have there in-house. So this is why it is very, very important, before, whether it be voluntary programs or state-sponsored programs, it is very important that new inmates or clients are properly screened for communicable diseases, infectious diseases. They also need to be evaluated to establish whether they have proper insight and motivation for recovery. Because a person, and this I have seen very, very often, their parents could afford it, so they pay and send them, but they are not motivated. They're just going along because they have to. And when you have clients like those who are not motivated, who don't think they have a problem, then they do not willingly participate in the various aspects of the program. And by doing so, they cause a lot of disruption within the institutions as well, because they with their negativity and they usually cause a lot of disturbance. They get into conflicts, and they always challenging the rules. You know, if you have a program where clients are not allowed to smoke cigarettes, for instance, you'll find they would be the ones who would want to be sneaking in the cigarettes. And sometimes the family who were enablers outside continue to be enablers, meaning they, just so that their relative would stay in the program, they would sneak the cigarettes in and give it to them. And now, of course, they having cigarettes, they will spread it in the population. News get around very quickly within treatment facilities. You know, John has cigarettes, and now I have seen batches of patients being discharged from treatment, and because they break the rules, because one of the rules for smoking in a program or using any drug usually is discharge from the program. And so now you lose a lot of people who would have done very well, who were really doing well in the other aspects of the program. Now, for those people listening, those brothers and sisters who are listening, let me just give you an idea what happens when a person go into an in-house program. After evaluation, once they admitted to the program, they go through what is called detox. That is, especially if they were using up to the day before they came into admission. So let us take Cora Hospital, which is the government-run program, which is similar to most in-house programs, but this one is staffed by doctors and trained professionals. The person coming in on a Thursday, usually Thursday is the day for admission. It's the clinic day where people are assessed, and if you are found to be motivated and they have space, you will be admitted into the inpatient program. Now, from the history, if the staff became aware that you were using up to the day before, you go directly into detox. Usually detox is between 4 to 6 days, where basically for the first week of that program, which is a 6-week program, you spend it by yourself in bed. You just basically get up to eat, use the washroom, and go back. You don't mix in the population because you are in detox. It's a time when you receive a lot of one-on-one counseling from your primary therapist. A primary therapist is assigned to you. You become the responsibility of one particular person on the staff, usually a trained psychiatric nurse. You also have a social worker, and you have a psychiatrist. And so you are screened. During that time, you're also screened, your blood test is taken, a history is taken, it is your samples are sent for evaluation. And so that this is why you remain isolated from the population during that time, because we are waiting to see the results, to see what condition you are in. In other words, it is a very comprehensive program, very effective program. And as I say this, although it is a 6-week program, research has shown that even short-term programs, they're just as effective as the long-term programs, because I worked at Cora Hospital as a psychiatric social worker there, but I was also director of the Piparo Empowerment Center, which is at Piparo, and that is usually a long-term program. You would stay between 6 to 9 months there. And I dare say that your success in recovery is largely dependent on your level of insight and motivation for recovery. So it really doesn't make a difference. You would find, though, that the Piparo Empowerment Center was able to treat with people who were mostly homeless, which is slightly different to Cora. Cora people, the people who come to Cora were not generally homeless people. They had a place to go back after their 6 weeks. The people at Piparo, for instance, when the center was operational, I understand now it's been closed down. I'm not very much aware because I left. way back then in 2003. But long-term, the point is long-term programs does not necessarily have an advantage. Although relatives would prefer long-term programs because they just want to get this person out of their household, you know, put them somewhere where they become less of a humbug, and so that maybe after 9 months, when they do come back, they are brand new and they are all healed. Well, you don't get healed from substance abuse. You can, with substance abuse, if you're an alcoholic, you'll always be an alcoholic. If you're a drug addict, you'll always be a drug addict. That is to say, you can't go back and use alcohol or drugs. Not that your behavior remains the same. No. In recovery, an addict can become a much more better person than they used to ever be. An alcoholic as well. And we have seen that once they're on the program, they are able to realize their full potential as a human being and regain their respect and all of that in society. But coming back to the choosing a treatment program, yes, if you can get into a long-term program, I would suggest is more like for people who have reached to homelessness, so that while they're in there, plans can be put in place to rehabilitate and rehouse them when they leave the center. At Cora, for instance, this is a short-term program which is better suited for people who are employed, fully employed, who has a family and all of that, because they can't be, it is not the best thing for they to have to remain away from their job or their family for all that length of time. So a lot of people are able to get time out, maybe holidays, they go on no pay leave, and or they get vacation leave and they come to Cora, and after 6 weeks, they are able, that 6 week gives them a break. It's like a sanctuary, it's like a holiday from the drug addiction, because you can't get the drug there to use, even if you get the urges to use it. So it's a very effective program in that regard. Now, even those people who came to treatment, whether in long-term or short-term program, came to Cora, for instance, who were not motivated, who were pressured by their employers or their spouse or the police or whatever to come, the center can help those people to break out of denial. And one of the most powerful tools to help people to come out of denial is the small group sessions. A small group session is between 5 to 7 people sitting in a circle, and you would have in that circle a new person who just joined the program, and people who have been there and about to be discharged from the program, who have developed proper insight and who have now accepted that they are alcoholics or drug addicts, and they are able to help the new person who is still in denial. The same way friends can help one, encourage them to use drugs, so too friends and the group can help a person to develop insight, because the new person sitting in the group, these are what you call open-ended groups, where people can enter at any time and they can leave when it is their time to be discharged. And these groups are usually facilitated by a trained professional. That was one of my responsibilities when I was there, to conduct the small group sessions. So in that regard, it is different to Alcoholics Anonymous and these other groups, because in the treatment setting, these groups are facilitated by a trained professional who is able to facilitate the discussion around helping the new person to break out of denial. So let's take a peek what happens in a small group. Let's suppose the new person is sitting in the group and saying, look, I never really had a problem with my alcohol. You know, I was able to still provide for my family, and you know, I used to just take a drink occasionally, and you know, I never got drunk and all of that. Because one of the symptoms of addiction is dishonesty. So that most alcoholics and drug addicts, they use that dishonesty to cover up the true picture of their condition. But sitting in a group at first, the facilitator will not ask the new person to participate very much, would encourage them to just listen. He's the gatekeeper in the group, and he would usually ask other people who have a satisfactory level of insight to share their experiences. And they would speak about, how they started. Now that they are able to be honest, they will speak from their heart. They will not make up a story. They are able to face the truth of their life. And they will speak about how they came to start drinking, what are some of the things happened because of drinking, how their drinking progressed, from occasional to regular to chronic. What are some of the things happened with them because of their drinking? And in so doing, the new person is listening to this and he's identifying and realizing, but wait, most new people always thought it was only they who suffered like that. It is the first time they're hearing other people saying, but the same thing happened with me. I did the same thing. I drank and this happened, and the therapist looking will see that they are identifying, because you can look at their face and see their expressions and know from training and experience that the person is identifying with what is. Sometimes they're actually nodding their heads, realizing that they're concurring with what the older person is saying, the person in the group who has the insight. And I've heard new people say, boy, like you all tell the person about me, because alcoholism is no matter where you drank, or what your status, whether you're a laborer or whether you're a professional, the same things will happen with you. One may be vomiting in a drain in Caroni, and the other might be vomiting on the carpet in West Moorings, but they're still vomiting. They're still getting sick. They're still losing days of work. They're still misbehaving with their family. They're still spending money they did not intend to spend. They're still not showing up for work. The same things happen with the others. So in that setting, by the time you get to the new person, he realizes, look, you can't fool these people. An alcoholic, practicing alcoholic can't fool another alcoholic who is in recovery, because they've been there, done that. So that encourages him as well, because he realizes, look, it is not such a bad thing to admit when you have a problem, because you are told you're not a bad person, you're just a sick person. And this is because of your illness, because of your addiction. And they could see when they were probably drinking socially and how their drinking morphed into compulsive alcoholism and compulsive drug addiction. So that helps them gradually over the 6 weeks that they're there. And if the therapist realize from the small group session, this person is still having difficulty to ventilate, to come out, to admit, to own up, that is when, of course, the therapist and the social worker like myself will take the person in a one-on-one session, because you realize that, look, they realize they have a problem, but they don't want to speak about it with other people who are strangers and so on. And so you help the person to get out of that denial. So that is the most important thing. The person has to realize that, look, it was not because of my wife or my parents not giving me the inheritance, or my job, or my boss didn't like my head, and this is why I was drinking. They begin to shift from that and realize I drank because I was an alcoholic. I used drugs because I became addicted to it. You understand? And they also develop insight into realizing if they continue to use drugs, what is going to happen with them? Because very often we ask them the question, if you continue to use drugs, tell me, sit and think for a minute, 5 years from now, is your life going to be better? What is going to be your position? You understand? So sometimes that is a wake-up call for the new person. So that it is from the development of insight and motivation that the person will now become prepared to do the things necessary in order to recover. So that there are other aspects. For instance, if I should describe the treatment facility at Cora, and when you're looking for treatment facilities, you'll want to see these various components if they are there. One is that they have professional staff, because professional staff will be able to pick up on psychological problems, psychiatric problems, health problems, and all of that, do proper evaluations and blood tests and lab reports and all of that, so that when you come out of there, you are more complete and ready to stay in recovery. So you also look at the program of activities. For instance, as I said, the program needs to have a period of detox. When a person is in detox, they're in crisis. They just came in, they're now recovering. They're going through the withdrawal symptoms. It is a time when they're very vulnerable because they're away from home now, they're in a strange environment. And it is a time when primary caregivers, the primary therapist, the person assigned to the person, is best able to form a relationship with them because they're looking to make a friend with someone. And you would find during that detox period, they are willing to speak one-on-one with their primary therapist. For all those reasons I said, because of the feeling of powerlessness and vulnerability and all the symptoms of withdrawal and so on, the shakes and the insomnia, they are able now to reach out, to be receptive to making a relationship with someone. And you'd find a lot of patients who, by the time they come out of detox, even before they get to the other activities, the small group, they have already realized that, look, I have a problem and I need help. But for those who still are stubborn, and this small group is an additional attempt. But all the other parts of the recovery program, the treatment program, the schedule, timetable at Cora and these other treatment facilities are geared to help the person to develop insight and motivation for recovery. So, all right, so the first day the person comes to the clinic, they are seen by a professional, myself or the doctor, and an assessment is done. In the assessment, one looks at the progression of the disease of alcoholism. You look at the amount the person has been drinking, the frequency, and you also look at the consequences and how aware they are of the consequences. There's a lot of things that, as a professional, for instance, if the person came alone for assessment, that tells you something. It could mean that they're highly motivated. They didn't have to be pressured or dragged to the center. If the circumstances under which they came will tell you of their level of motivation. Even from speaking with them, their willingness to admit that they have a problem will also tell you their level of motivation. All of these things. So that, and their willingness to divulge information about their withdrawal when they're not using, what are some of the things happening, because that will help the professional to stage the disease. Because alcoholism and drug addiction, there are stages here. You have the beginning stage, you have the middle stage, and you have the chronic stage. The people in the chronic, usually most of the people who come seek help or volunteer to come for help are people in a chronic stage. That's when they're already starting to hallucinate and all of that. So each assessment and evaluation will determine the needs of the person. In taking their demographic information, their name and address and so on, you will also want to assess whether they live in a high-risk environment. Because if they live in a home where there are other people who are drinking still, or live on a junction where there's a drug block right next door, and so on. If they live in a high-risk environment, that would indicate that you may have to take them into the inpatient program. If, however, they have good family support, they have a good job, and they need to go to their job, all of these considerations determine whether you would want to treat them as an outpatient. Again, distance from the treatment facility. Outpatients usually are people who could come to the center maybe once a week to join the outpatient treatment program. But let's suppose if the person is living very far in a remote place without ability to their own transport or ability to commute, you may have to consider inpatient treatment. So that all of these things are determined in deciding whether a person will come into inpatient program or outpatient program. Now, in the inpatient program, as I said, you go into detox, you have complete lab reports, blood tests, and all of that. You build a relationship with your primary therapist. In most treatment centers, every morning there's a community meeting that is facilitated by a trained staff. At the community meetings, misbehavior in the center is dealt with. Any problems, that other patients might be having, or conflict between patient and patient, those things are dealt with in the community center, and the patients are taught how to resolve conflict by speaking about it. The ability to say your piece and then listen. All of this is happening in the community meeting, so that you learn how to function within a group. Remember, when a person is using out there, they lived a very unstructured life. They sleep when they want, they get up when they want, they don't care about anybody else, how they treat other people, how other people feel, they're very selfish. The community meetings deal with all of those things, where you have to get up at a particular time, you must go have your shower now, you have to secure your clothing and all of that. You can't be stealing from other people, their stuff, you have to be able to watch it and leave it there. So there's a lot of dynamics going on when you're in an inpatient program, that in very open, obvious ways and in very subtle ways teaches the patient, the client, the patient, to move into rehabilitative type living. So in the community meetings as well, you learn how to resolve conflicts. And it is also used as a diagnostic tool by the staff to look at, who's having difficulty and who's managing okay. And again, you are further getting more knowledge about their level of insight and motivation for recovery. Then, of course, even at breakfast, there are rules. After you get up, you have to clean up after yourself. You need to take your wares to the stand. You need to put back your chair in place. All is about returning a person to structured living from unstructured living. So every activity in a treatment facility is deliberate and pointed towards recovery. Nothing happens in a treatment facility that is ad hoc or by guess. After community meetings, of course, there will be, sometimes they allow, there's physical therapy, because exercise is a very, very important part of recovery. Other people might tell you, boy, you're looking good, you stop drinking, you stop using drugs, you're looking good. And that is a great help when you get feedback from your siblings or from your visitors or from the other patients or from your staff. But a more important and powerful feedback is when your own body starts telling you, hey, when is the last time you felt like this? When is the last time you had a full night's sleep? When is the last time your muscles were tingling like this and you're feeling strong, you're feeling confident? Because recovery, alcoholism as a disease and drug addiction as a disease, does not only affect the biological man. As human beings, we are biopsychosocial, spiritual beings. And this is one disease that will affect all departments. And this is why any treatment program or any therapist working with alcoholics and drug addicts need to, of necessity, approach all four areas of the person's existence. You need to look at their biological self, that is their bones and muscles and all of that, that became emaciated while you were using drugs. So hence the lab reports and the blood tests and all of that. So now we're giving them a proper diet. And with a proper diet, if they don't exercise, the body is not going to be able to use the food properly. Exercise is like a tonic in rehabilitation. And so the person realizes beyond any doubt that, look, boy, I like this feeling. And they make the connection that I am only feeling this way because I have stopped using drugs and I am doing the right thing now. So that there's a certain amount of physical improvement. The body starts telling you, but there's also psychological comfort because now you don't have to deal with the anxiety and the depression following every bout of drinking and drug use. So there's a lot of psychological comfort. You're sleeping better. You're getting good feedback from other people. Nobody's quarreling with you and insulting you now and all of that. People are complimenting you, and so that your relationships start to improve because you're starting generally to stop being selfish and inconsiderate of others. You don't touch people things. You don't say harsh things to other people, and a whole new life. You start being introduced to a life in recovery. And even people who were mentally challenged, I have seen them recover and stay in recovery because of the feelings, the body, just the body telling them, look, I'm feeling good enough. You understand? So there's physical exercise, and it is really done in sports so that the staff may organize a cricket match or some kind of sport, tennis, so that they learn, they're getting the exercise, but they're enjoying doing the exercise rather than, marching and lifting weights. Although some people might wish to do that, go in the gym, that is good too. But when you play sports, there's an additional benefit in that now you have to learn how to take losses, how to deal with winning. You understand? How to be honest and don't cheat in the game. So that two things are happening at the same time. Your body is becoming more fit. After every game, you feel good, you feel high. You learn how to deal with, as I said, losses and mistakes, in a very nurturing environment. Then the program also has occupational therapy for people who may have missed out, they drop out of school, they don't have a skill or a trade when they go back out there, so that you have occupational therapy where you can learn handicraft, you can learn other skills, you listen to lectures in business development, you have lectures in stress management. So you get into productive activities so that when you leave, if you don't even have a job, there are things that you can do to keep yourself occupied because, a saying that we learned all in primary school, that an idle brain is the devil's workshop. So that the occupational therapy is to keep a person occupied and also to teach them a skill when they would have left the center, that they can find productive and useful work that can generate income for them if they were unemployed and so on. But at least while they are in there, some of them create things, make little handicrafts that they can take with them when they go home to look, I made this thing, I created this while I was in there. It's a memorabilia for them. And then there's, of course, lecture sessions, didactic sessions, where they are taught the nature of alcoholism, of drug addiction, and they learn about their disease. When I was there, they were also offered acupuncture during detox, which was found to be a better option than using chemotherapy because you can't get addicted to acupuncture. But a lot of people could become addicted to the sleeping pills and the tranquilizers and all of that. And we Trinidadians, we read the label, and as soon as we go outside there, we go and common sense will tell you you can't use drug to treat drug addiction because you'll be substituting. And this is why acupuncture has been found to be the more suitable option. So that there are other activities in a structured program where you also learn that you have to go to sleep at a certain time. You have to get up at a certain time. You have to carry yourself in a certain way. And then, of course, you're continually evaluated while you are there in the program, whether it is the short-term program or the long-term program as used to be offered by Piparo. There's a constant evaluation. You also learn what is called consequential thinking. That is to say, if I do this, that will happen. Because that is one of the problems a lot of alcoholics and drug addicts kind of blanked out. They never thought consequentially that if it is the drugs that is causing the problem, if I go back and use, what will happen? And not only were consequential thinking in relation to drugs, but in relation to any other activity. For everything we do, every choice we make, there are consequences. You understand? So the person has to be able to now start to step back, look at themselves, and think first before you do something. Because you have to think, what am I doing and why am I doing this? What will be the consequences when I do it? And so this is what helping them to build insight. This is what will sustain their recovery when they go out. Now, there are other activities in the treatment facilities, but time will not permit. Fact of the matter is that while in the short term and in the long term programs, what they also have is an introduction to Alcoholics Anonymous and Narcotics Anonymous, even while they are in-house in the inpatient program. So that at Cora, I know that Alcoholics Anonymous would go and hold meetings there, so that before a person left the center, they would have been introduced to Alcoholics Anonymous. Prior to discharge from the program, like on their 5th week, they are given a weekend pass to go home as a test to see how they're relating to that environment in which they came from, whether they got the urges to go back and use. And during that weekend, it is expected that they will go to an AA or NA meeting. So when they come back on Monday, they can share that with their community that, I went on weekend leave and what happened, what I did. And you look at the choice of activities they chose. If they wanted to go back in line with their old friends again, or they wanted to go party and expose themselves to the temptations, because all alcoholics and drug addicts have what is called triggers. Maybe in another program, we'd look at some of the triggers that alcoholics and drug addicts have, because these are the things that usually preceded their drinking and drug using bouts. So that the weekend leave is a sort of a dry run of what it would be like. And it has been found to be very useful on a weekend that they link up with somebody who's in recovery in their community, a member of AA and so on. And when I was at Cora, we had a list of people all over Trinidad who were in recovery, who had many years of experience and who were willing and able to do what is called temporary sponsorship. So if a person, for instance, from Felicity was at Cora, and when before they reach the 5th week, even from the 1st week, it would be brought to attention. I would probably go and say, look, do you know this person from Felicity? A person who has given permission to use their name because they are willing to work with new people. And if he says, yes, I know this person, so that relationship is already connected. That person is allowed to visit them while they're at Cora and, start the relationship, so that when they're ready to come out on the Sunday, the weekend, this person usually will come and get them and take them to an AA meeting and all of that. kind of chaperone them for the weekend, make sure they don't go back and drink, and then they come back, and then the next week they're discharged. But when you're discharged, you are just not thrown out there to the lions. You have to come once a week for a little while to the follow-up group. So you come out on the weekend, and then on Tuesday you come back to follow up to tell us how things are going. And follow up, a person is encouraged to attend as long as they can, at least for the next 3 months. And once they have joined the AA group and they're staying sober and all of that, then you know that they are in recovery. Now, at the same time, some amount of family therapy is done with the family, preparing them to deal with the new person when they come, how to relate to that person, to understand that the person was a sick person, not a bad person. So I know we are coming up on time, and I would want to let all our listeners know that if you have a question that came to your mind in listening to this program today or even subsequently, I can be reached at 671-3040. That is 671-3040. And you may raise any questions, or if you have any comments, you can visit the program. It will be posted in a few minutes, the same program, on YouTube under my name, Ramnaresh Dwarika. And you can, of course, comment. You can post any questions you may have, and I'll be happy to respond to it. Or you can call me at the number given on your screen after the program, and I'll be happy to relate to you. So I want to thank you all for listening. I want to thank Jason for hosting the program, and all the people in the back who from time to time put together very, very valuable and useful information. And to make this book, and I want to thank the management of Radio and TV Jagriti for giving free airtime for this, to facilitate this program as a public service to all our brothers and sisters who are listening here, and to remind listeners that this program is posted again at 10. It is rebroadcasted at 10 p.m. tonight, but you may, if you wish, go back and listen to it. So I want to thank you all again and thank the staff for hosting the program.
And of course, you can join us next Thursday. Until then, I am Jason Kalu saying see you for now.